I'm excited to be here and actually feel really honored that Dr. Edwards asked me to present. This has been a really educational experience for myself. My husband, Carson, actually he's a PA, so he comes pretty regularly as well, but I feel like the last couple of months I've been like, I gotta go every week so I can make sure I can get my bearings, just, giving a good presentation. So today, I'm a massage therapist. I work and own a small clinic in Orem called Revive Massage. And today I want to discuss the evidence-based practices within massage therapy and that it's more than just a luxury. So what have been your experiences with massage? I want to hear, good, Brandy's here. 'Cause the good, the bad, the ugly, the awesome. Yes, hi. Lindsay, right? Yes, great, love it.
Yes, I feel like I got in a car wreck not that long ago, and
cool.
It really helps. Like I can tell when my muscles get tight,
yeah,
and I start to get headaches from it. Massage has been like a very therapeutic thing for me.
Love it. I actually thought about you while I was putting this together because I had heard that you'd been in an accident, and we're actually going to touch on that a little bit later. Who else? Yes.
I've had a variety of ones of where it's compression, where it's heat, different forms of therapy with it. And I feel like depending on what I've done, whether it's through sports, athletics, or whatever it may be, I feel like it usually has been helpful.
Love it. Yeah, that's great. Any odd or funny, crazy experiences? I feel like I've heard tons of stories as a massage therapist. I'll have clients be like, yes.
I used to live in China for a couple of years.
Yes, okay, love it, okay.
Whenever you get your hair cut, you get a full upper body massage.
Okay, why do we not do that in America? Doesn't that sound amazing, guys?
It was amazing until I got my hair cut.
Yeah, that's awesome.
My wife and I were getting massages once, and I had this tiny, she was 5 foot nothing, 80-pound Chinese lady. She rubbed, and I was like, a little more pressure, that'd work. And pretty soon I know she's rubbing with a third hand, and then a fourth. And I looked up over at my wife as we're laying down, and she's just staring at this 5 foot lady crouching down on my back, trying to massage me with both hands and both legs.
Oh my gosh, that's awesome. That's
Hey,
awesome. That's awesome. Oh, that's great. Yep. Any others?
I went to Vietnam this
Cool.
past year, and in Vietnam, at the end of the massage, they start cracking your neck.
Oh, yeah.
That one freaked me out a little bit.
Yeah,
so
that would be. Yeah.
A odd one I had in Mexico is they took just a cloth and put it around different parts of my arm, and then they put a wood rod through it and twisted it.
Oh my gosh. Yeah, that's interesting. That's awesome. Well, I will say I don't do a lot of those interesting kinds of massages, but let's talk about some of the benefits of massage therapy. Now, in my clinic, I work with a lot of medical professionals. I actually operate inside of a chiropractic office. And so a lot of what we see are a little bit more medically based. Now, that doesn't mean that we don't do other things. I love working with pregnant women. I do a lot of pregnancy massage. We're trained in hot stone. Some of us are trained in scraping and cupping, those kinds of things as well. And relaxation, there's some great things with just having a relaxing massage that we'll go into in just a minute. So the main benefits for massage is obviously pain management. There's been a lot of research that goes into especially chronic issues like fibromyalgia and rheumatoid arthritis. We have a lot of autoimmune disorders that we struggle with pain, and there's been a lot of studies that have shown that massage therapy can be very helpful in that. Stress and tension relief. Lindsay kind of talked about with her experience, how it's, you feel those tight muscles, and I'm sure many of us who've had massages, you do feel a lot of that relief. Improving circulation, increased range of motion and flexibility. You can read the list, but something I really want to touch into that I thought was really interesting as I was preparing this presentation is the more emotional and mental response that comes from massage therapy. In some of the research articles that I read, it talks about there's a vagal response where it actually decreases the heart rate. There's an decrease in cortisol levels, an increase in serotonin, and they did. There's a couple of studies I read where they had individuals where they did 20 to 30 minute moderate to light touch massage, and they did EEGs on them before and after. And for those that were actually with depression, they showed that their side of the brain that was more for like happiness and hope and things like that was firing more after massage. And I thought that was really interesting, especially after just a short massage. And I think we live in a world where so many of us we're stressed and we kind of run at a really fast pace these days. And so this was really interesting to kind of see how beneficial massage can be. Now I'm gonna go into a couple different things I see often in my clinic. So going to personal injury, I do work with a lot of prescribing physicians and do work with like a lot of auto accident patients. And I've done that for almost 12 years now. And so I'll have chiropractors, physical therapists, other prescribing physicians that will send me a prescription for massage, and then I'll work with those patients, billing their car accident their auto insurance, and helping them work through that, their auto accident related injuries. As you can read here, it says in the United States, approximately 6 million motor vehicle accidents occur each year. And when I read that, I thought it'd actually almost be more, but I think it's probably because that's what I see all the time. So you feel like everyone's getting into accidents. But one thing that I really wanted to touch in is the importance of like early intervention with auto accident related injuries. Is the study that I read was they took about 100 individuals and they watched them over a 3-year period of time. And for those individuals that they were seen either just up to 4 days after their accident, or it was 2+ weeks after the accident. And those that they followed for the 3 years, at the 3-year mark, they noticed that those individuals who were seen within that 4-day, they had better range of motion in their cervical spine, and that their muscle and tension relief from those auto accident related injuries were almost that of nothing at that 3-year mark, which I thought was really interesting, just the importance of early intervention, which I too have seen that. I feel like when I have patients that come to me and they're like, oh, my accident was like 3 or 4 months ago, and we can still work through and help them a lot, but sometimes I feel like they struggle to really kind of overcome. They kind of hit this little bit more of a plateau, and they tend to take a little bit longer. Right now, I put up just right now something that we're seeing in my clinic currently is we have a 34-year-old female who presents with upper cervical pain, lower back pain, and then she's got an increased intensity and frequency of headaches. So as medical professionals, for those of you who see situations like this, what would be your treatment plan?
I think when they've been in an accident, restoring motion is really important.
Absolutely.
So I think about it's probably some sort of ligament injury in many of these patients. And when a ligament is injured, it triggers the muscles to spasm, and then everything becomes really tight. But appropriate loading and movement is one of the ways the ligaments heal. And so it's sort of a little bit counterproductive.
Yeah.
So there's a fair amount of education that goes into it, helping the patients recognize the nature of the injury. It's a little bit like spraining an ankle, but it's more an area that you can't just ignore as much, or it's always there. So trying to get them to move and to recognize the nature of the injury is really important.
Yeah, absolutely. Thank you. Any other thoughts?
Yeah, I'll pretty quickly get them into physical therapy for the same reason. Provide them with some reassurance if we've seen the imaging and know they're okay, and then get them into physical therapy to work on strengthening and mobility.
Yeah, perfect. Yeah, I love that. And I feel like usually when we receive a prescription from a prescribing physician, they've usually been working with a chiropractor or physical therapist, and then they just want massage therapy in order to help aid in their helping with their muscle. And then we'll work, sometimes we see them once a week, sometimes twice a week, depending on the length of session. And usually within 4 to 6 weeks, we'll usually start to taper. I just do as the prescribing physician tells me. But it's kind of amazing. I feel like it's a roller coaster. I always tell patients when they first come in, it's when you've been in an auto accident, it's like you'll have times where you feel great, and then you will have other times where even just the next day or in a couple of days, you kind of feel like you got hit by a car again. That's very normal. But then usually after about 4 to 6 weeks, we're starting to see more of an upward trend that they're feeling a lot better. I wanted to share, this is just a little video of myself working with a patient. When we work with auto accident related injuries, we work a lot on like the posterior neck. We're working on a lot of the with whiplash, right? There's a lot of issues into that. And then I kind of hone into those suboccipitals as well. This is just a short video. It was actually done for Instagram, so it's just short. But the importance of helping to regain that mobility into that cervical area, so many of them struggle with like headaches and things like that after. And that's always for me, it's kind of a good marker of knowing and understanding like, oh yeah, okay, your headaches are almost all gone. It's just a good way for them, kind of a good benchmark that they can really see for themselves. Okay, something else that I see a lot in my clinic is issues with TMJ. Part of the reason this is a little niche in my clinic is I worked at the dentist for a couple of years after I got out of massage school, and I have training. I got special training in doing that. So I do a lot of work on TMJ issues, a lot of inner mouth work to help with patients who have issues with that. This is one of my patients. Her name is Alicia. She went through, I put up these images because this has actually been one of the funnest things for me to come to rounds. I'm not, of course, trained as a massage therapist in reading imaging, but it's really cool to look at images and to kind of understand the anatomy and to see the anatomy. So I've been working with her about 10 years, and unfortunately during her pregnancy, she had her bones like just leached a lot of calcium, and one of the joints that was affected was her TMJ joint. And she had a complete erosion of her left TMJ. And so if you can see right here, this is a before picture before she had surgery. She can bite down completely, like her teeth completely touch on the left side, but then on the right, that's her tongue right there, she can stick it out because her teeth can't even touch on that side. Very painful. She dealt with it for about 5 years before she actually went through and got surgery. So as you can see right there, she's had a complete jaw replacement. It's actually quite fascinating when I work on her and doing inner mouth work, because on her upper lip area, it actually feels like she has like braces in there because she just has all this hardware. So when I'm working with her, I'm doing, she has a lot of tension in like her head and face, which is very common with those individuals who have TMJ issues. But I'm working on like opening her mouth and working through the pterygoids, muscles in the mouth, even on the outside facial areas as well, in order to open that up. When I was looking at the research behind massage and TMJD, it's kind of overall, the best practices is to do massage in conjunction with other therapies, and I have too seen that. Usually when I have individuals who come to me, they're working with a physical therapist, as Alicia does. She actually is also working with an occupational therapist, working on just keeping, being able to like speak and hold her mouth open. It's amazing how much tension she still has even 5 years post-op. They talk about in one of the research articles I read, it says massage combined with post-isometric relaxation increased maximal mouth opening. And that's oftentimes because of that pain in the jaw, they have a hard time really wanting to open, because when they get to that widest point of opening their jaw, it can be very painful for them. Anyways, just overall, I feel like they had just said that massage can be so great when it's combined with other therapies. I work with a chiropractor who does TMJ. He knows how to adjust the jaw, and that's been very helpful for a lot of our patients to have that. Do any of you work with patients who've had TMJ, and what are some of the things that you have seen in your offices, and how have you helped those patients?
Yeah, so I'm a massage therapist too.
Love it.
Massage therapist for 25 years, a long time. And I'm a PT now, and so I use a lot of dry needling.
Love it, yes. That's so great.
And neck, you have to mobilize the neck.
Yes. Mm-hmm. Yep, absolutely. Thank you. Any others? Yeah.
I use, probably after all that is done, we PRP a lot of these.
Oh, I love that.
Then we PRP them, and then we also typically treat the upper cervicals while we do it, the temporalis and masseter as well.
Yes.
So it's not just an intra-articular injection. We
Yes.
treat the small ligaments around there.
I love that. Thank you. many of the patients that I've seen, of course, this is the most severe that I work with, and I see her on a regular basis to help just with maintenance. But a lot of people just have like clicking, popping in their jaw. Some of that can come from an accident. Some of it can actually come from, dental work, prolonged dental work. There's a lot of different issues, but there's a lot of benefit that can come through massage therapy and working with other medical professionals as well. Okay, let's touch into lower back pain. Who has lower back pain in here? Okay, yeah. Yeah, exactly. That's actually one of the reasons I wanted to touch in on this is lower back pain is so common. How many of you have had individuals that walked into your clinic and they're like, oh, I've got this like really bad lower back pain, right? Okay, what do? How do we help them? Next patient. Seen that, done that.
I think you're asking a difficult question because there's nothing simple about simple low back pain.
Totally. Yep.
And there's so many different causes that you really have to dig into it.
Yep. So where do you start? Where do you dig in? Tell me what you start with.
I like your Edwards analogy. It's just like real estate, location.
Totally.
I just love that because it will tell a lot.
Yeah.
And then you have to decide what hurts.
Absolutely.
And where and why. And do they belong in my physical therapy office? Do they belong over here?
Mm-hmm. Absolutely. What have been some of your experiences when they've come in? I guess what are some of the most common reasons for lower back pain that you've seen in your clinics?
I mean, we're about to get into gardening season. So there's going to be a lot of I was carrying sod and shoveling bark showing up here.
Okay, yeah. You're like just waiting for it. You're like, oh yeah.
There's a whole lot of that.
Yep.
Coming around in the next couple months.
It's like when I feel like in January I get these people that are like, oh, I got this shoulder pain because it's like, oh yeah, I just started doing all the push-ups, the pull-ups, all the things because they're trying to get back into their New Year's resolutions, What else? Where would you start? If you had a patient that came in, what are things that you do as medical professionals? Yeah.
I think with all of these issues, you start with a good history of physical and
yes.
kind of a diagnostic workup, and then back to can you go back to the slide just before?
Mm-hmm.
Where it says massage therapy complemented with other therapies has maximal benefit. I really like that line, and I think you can almost substitute any treatment in that line.
Yeah.
Physical therapy complemented, surgery complemented, chiropractic, pain management, home health, skilled nursing, all of it. And so the idea being that with all of these problems, really understanding what the nature of the problem is, and then building sort of comprehensive care plans that maximize the benefit and minimize the risk is kind of the basic model, and not forgetting about things outside of your narrow scope. Because all of us, well, some of us have a more broad scope of practice than others, but still all of us in some respects sort of focused in on one area, and so incorporating everybody else is really good, especially with the complex and sometimes lifelong and aggravating problem like lower back.
Absolutely. Yeah, thank you for sharing that, because I feel like that's one of the reasons I'm asking, is I like to know what do you all do so that I can have an understanding of, like, hey, I've got this individual that I know who can do these types of things. I love dry needling. Dry needling has been so great. I've done dry needling, acupuncture, TENS units. There's so many things that can be helpful as complementary things to go along with with massage therapy. I feel like right now, some of the common issues I'm seeing in mine is I've got a lot of runners who are kind of prepping for the next, half or marathon. So I do a lot of psoas work and hip flexor work in order to help alleviate that strain that's put on the lower back. When you have that lower back pain, oftentimes you have a lot of tightness. Who's ever done like deadlifts? This just happened to me like this last week. I did a ton of deadlifts, and then like the next few days, like my back was just felt so tight. And part of that is because of that pain through your hamstrings kind of pulls down on the glutes. It always puts extra strain on your lower back. And so when we're doing lower back, it's not just focusing like we talked about with like what Dr. Edwards says, like location, but understanding what happened in those types of situations And so, for me as a massage therapist, the things I can focus in are muscle related. So of course I'm going to work through, the lower back area, working through the QLs, working into their glutes and in their hamstrings. But then on the flip side, let's also make sure we're working through the hip flexors, because oftentimes you have a over lengthening in the hip flexors often, and that's like pulling them forward. So their hips will go forward like this, and then it's an over lengthening in the hamstring. So a shortening in the hip flexors, over lengthening in the hamstrings, and helping to refine that balance for them as well. I do find that hip flexor and psoas work can be very helpful, like I said, especially with runners. But also think about what you do. Maybe not all of us, but I know a lot of individuals. You sit at a desk all day long, and what does that do to our hip flexors? It just shortens them, right? And so then you have individuals who come in and they've got this lower back pain, and part of that they talk about is like lack of mobility. Like we're just so more stagnant these days, and how important it is to encourage our clients to get up and like move and stretch and walk, because that shortening in the hip flexors can cause more issues in the lower back as well. And then not to mention, unfortunately, we're dealing with a population that is more and more overweight, and there's multiple complications that come with that, with lower back pain. You have individuals who carry a lot of abdominal fat in front, and so again that puts more strain on that lower back as they're trying to compensate. They have a very weak core, and so we're putting a lot of strain on that as well. And then to go kind of in conjunction with that, who's ever had a stomach ache or menstrual period cramps where you then affects your lower back? It's like there's so many things that are interconnected with that, with the lower back and gut as well. And so many of us struggle with a lot of gut health issues. And that can definitely affect the lower back as well. And I know that going back to my slide is, as I was looking at the research, it was really interesting. I was telling Jennifer, as we were starting, massage can be great for lower back, but it was like so many of the research articles kind of said like it's a little inconclusive. But I think it's because, actually I know it's because they say it in the research article, there's just so many different reasons for lower back pain. And so to be able to take a controlled study that has specific lower back pain, it's not really there, which I thought was really interesting, because as I looked up, as I was starting this weeks ago, one of the main benefits they said was to help with lower back pain. But then when I went to go look at the research, there's actually not any research specifically that says yes, you get a massage and it'll take away your lower back pain, or this is how it can help, or these are the type of modalities or type of treatment for those types of things. It's helpful, but I think it's very convoluted with lower back pain and massage. Any questions for me as a massage therapist? Yeah.
I have a question. When you're getting patient prescriptions, or you're saying the 4 to 6 week therapy before you see a good stroke and results, what is the frequency of that? Is that once a week, twice a week?
Yep. So it's usually 1 to 2 times a week, and we're working with either 30 to 60-minute sessions is usually how we've done it in our clinic. Now, part of that for me is it's based on the prescribing physician. I have some chiropractors who, when they send information to me, they're once a week for usually 6 to 8 weeks, or I have others where they're 2 times a week. And sometimes they do the 2 times just to say just try to get in, if they can just get in there at least once. So it depends on the prescribing physician. Great question. Yeah.
Similar to how PT can provide in-home things that they can be doing, are there other things that you can send your clients home with that they would be doing to aid in that recovery process?
Absolutely. Yeah, that's a great question. Absolutely. Definitely lots of stretching, self-massage. That's something with our social media that we've been trying to do more. Just sharing certain stretches, even just mobility techniques to help patients. For example, because of our jobs, a lot of us are like this, right? So our shoulders roll forward, our pecs become shortened, our rhomboids become overstretched. So a lot of people feel the pain and achiness in their upper back and neck. So if we can teach people to pull their shoulders back, let's help strengthen through the rhomboids. And then so stretching through the pecs, but then helping to strengthen that upper back. those are things that we would be seeing a lot of. Just so like stretching, mobility techniques would be things that we would send our patients home with. Okay, thank you.